Everyone can hear me, right? Okay, great. Okay, so I know it's towards the end of the day and there was a lot of information that was already provided. So I want to try to tailor this so that it isn't too detailed, that it's information overload. So the last two sessions, I'll try to be as short and concise as I can, but still be impactful for you to be able to get something out of it. And for this session 10 on PFAC, just a show of hands, how many people are familiar with PFAC? Okay, and then for those that had their hand up, do you have a PFAC already established and have you guys already met?
We have established a schedule.
Okay.
Yeah, working on it.
You have met. Okay, so I'll pull on you to actually share some experiences for others to hear in the room once we get towards the end of the session. So let's see, no disclosures related to this presentation. Objectives, two of them here for this session. They're also listed on the curriculum. If you have that out, it's in the folder, the agenda. Really quick, if you could take the pre-survey on these three questions, 31, 32, and 33. Rate your level of knowledge on PFAC. Okay, so starting off with what PFAC is. So it's bringing the key stakeholders, whether it's the patient's family members, or the practice staff together in a casual setting to elicit information from the patients and their caregivers to understand their patient experience and to actually hear the voice of the patient and understand the care that they're that's being received. So why is PFAC important? There's a number of reasons why. One, it has been identified as a best practice in the industry towards transforming care, and it's also grounded in a culture of patient-centered care. On top of that, again, you're able to obtain the feedback from the patient's perspective. It gives you a chance to build a relationship with the patient as well, and then the other thing is just to gain insights on the strengths, what your practice is doing well with, and then also identify those areas to improve with the care that your practice is delivering to the patient. Yes.
We send out surveys after encounters with patients. So other than the interpersonal factor, why is it so important?
We will get into that, yes. We will. And if I don't answer that question at the end of this, let me know, but we'll actually get into it, how you can use the data to really transform and identify ways to improve as well. So MDPCP requirement, we touched on this a little bit, falls under the beneficiary and caregiver experience function, but the requirement is to at least convene a PFAC annually. You can have a meeting more than once depending on how you establish your PFAC. And then also once you collect that data from the meeting, definitely incorporate that into the care as needed. So we touched on, what it is, why it's important, and then also the requirements. So the next couple of slides, we'll walk through the PFAC framework, and this is really just a couple steps on how to establish a PFAC. And these are just recommendations on how to get that going and started. So the first step, establish and maintain a PFAC. So there's, I think, two major components in this step. The first one is identifying a person in the practice that can be the patient experience champion, someone that will be able to lead and coordinate the efforts of the PFAC. And once you identify that patient or that person, then they are able to establish the scope for the PFAC. And establishing the scope is identifying the mission and vision of the PFAC, what goals that need to be accomplished with the PFAC meeting, any type of logistics on the meeting frequency, roles and responsibilities, just really detailing the plan so that you can have an effective PFAC and use the best out of it. The second component for this step is recruiting participants to be part of the PFAC. So definitely need folks internal to the practice, include administrative staff as well as clinicians. And then when you're recruiting the actual patients to be part of the PFAC, it's important to, you can identify criteria on what you want to use to identify the patients. So definitely looking at the demographics and making sure that the people that you are selecting for the PFAC, they match the majority of what those socioeconomic characteristics are that are being seen at the practice. Other things to include in the criteria if you're looking at for patients is what type of skills and qualities they may need, the patient may need to be able to participate in the meeting and provide that constructive feedback that you need to be able to pinpoint, areas to improve. So we'll walk through just an example using our test patient, Miss Anexa, and really highlighting her personality. So she's extroverted, a people person. She also enjoys attending group meetings, and then she also engages well with her peers. Now, one thing I want to jump back to on here, when you are recruiting the patients, there are certain ways that you can go about recruiting the patient. I've seen practices come up with an application for the patients to fill out, and then they also interview the patients to identify if they really do have the skills and qualities to be a good fit for the PFAC. So those are just two things to think about when you are trying to recruit patients. Also, somebody in your staff, they may have a good idea on who they think would be a good fit to participate in the PFAC as well. All right, so back to Ms. Anexa. So this is really just trying to illustrate some of the qualities and skills that you may want to recruit with a patient so that they can give you that constructive feedback and be able to open and share. So since she's an extrovert, she loves to share information about her experiences so that others can learn. She's also able to see beyond her own personal experience. So I've been in a situation where a patient had a really bad experience and they hold on to that experience and they just dwell and talk and want to talk about that experience. So if you have someone like that, it's great to talk about that, but you want to make sure that they're able to see beyond that personal experience so that you're not dwelling on the same issue, right? So that's definitely something that if you are going to interview a patient, that's something that you can kind of feel out for. It wouldn't necessarily, you wouldn't be able to identify that if they're filling out like an application to be part of the PFAC. Ms. Anexa also shows concerns for more than one issue, collaborates and listens with others, and then she also wants to make a difference. So just an example of what qualities and skills a patient may need to be able to facilitate or participate in the PFAC. So for step 2, this is making sure the PFAC is effective. The actual meeting is effective. And so for me, I think step 2 and step 4 are kind of in alignment. And I'll talk a little bit more about how step 4 kind of feeds into step 2. But making effective use of the PFAC meeting, it's making sure that there is an agenda established for the meeting so that you're using effective use of the time, right? You don't want to bring everybody in a room and then it's a free-for-all. Make sure there's structure there, so that helps with the agenda. And then also making sure that meeting minutes are captured. Any type of follow-up information is captured as well and documented. And some of the examples that I've seen with the PFAC meeting, like agenda topics, they're listed there. So patient safety and experience, marketing, whether it's like the outreach calls or letters that remind them, the patients to get into care. And then also the actual physical design of the practice office is an agenda topic that I've seen as well. So
where does this have to be documented? Is it in each individual participant's chart?
No. So if you correct me if it's like a when you report, right? Yes.
In fact, it's almost like a nonprofit entity of its own, so it has its own quote unquote bylaws. They keep it simple, and then meeting notes, and then you can put it in a binder, have this up PFAC binder, so that we can keep track. Now, for those who are more comfortable with electronic documentation, you can have it's stored in some electronic format. I don't know how robust your practice website or our patient portal is. But if you do have a website where you share other information that's not directly related to the clinical care, for example, every practice should have their own policies, probably employee handbook and things like that. So if you want to house it there, again, it's not supposed to capture patients' PHI. It's not supposed to capture. Patient John Smith said that he's, feedback from PFAC participant or PFAC. So it is pretty much about the content of the feedback you're getting and not PHI. So.
All right, so step 3 of the PFAC framework is communication. So definitely communicating the what changes have been implemented from the PFAC, not only to the PFAC members, but also to other patients that are being seen within the practice as well. Because that communication on those changes, one, kind of holds the practice accountable for making the improvements to the care that's being delivered to the patient. And then it also helps to kind of create that patient-centered care. And it's in the patient space that, you guys the practice is doing this to better improve their experience. And then I know there's already been some communications established, whether it's through the EMRs or outreach phone calls, but using the PFAC meeting to identify a good way to communicate that information. They may have some good ideas that will be able to reach the patients better than how you may be communicating currently with the patients. Okay, last step, step 4. So this is all about reviewing data. So data, to your point about the surveys that you're providing, right? So if I'm correct, the surveys are multiple choice, right? They're like here scales questions. So if you take a look at that data, you might see that there's an uptick, and this is off the top of my head, there's something wrong. Patients aren't being seen within 15 minutes. Like you see a spike in that. That's that quantitative data, the numbers, right? But you can really use that as an agenda topic in the PFAC to really drill down on, why they may not be being seen within that 15-minute time frame. And then that's when you can collect that qualitative data, the actual feedback and perspective to kind of drill down and understand and kind of correlate and tie it to that number that you're seeing. So that's why I think that step 2 and step 4, they're kind of in alignment, because when you look at data, whether it's utilization, patient experience data, that can drive the agenda topics to drill down and understand what you may need to improve within the practice. And then also, once you are having those meetings and you do identify what you want to make the improvement on, then it's important to definitely measure and establish goals so that you can see if the improvement is effective. So Dr. Okeke talked a lot about the PDSA tool, so that is a really good tool to use when you are going to implement a QI project from the PFAC.
Let me also expand on that as well. I know that this happened. I know my primary care provider's office stopped doing it, but they did it for a bit, and they had an iPad. It's a quick 5 questionnaire right after I see the doctor. Some practices choose to do that either using an iPad or a manual questionnaire to know or gauge the patient satisfaction before they get that information from HEDIS or from, in this case, CMS. So now they've asked for the patient roster that you guys submitted about 8 weeks ago. So you will know until that feedback comes, that, hey, here's your patient satisfaction score. So some practices want to own it and say, hey, we can do our own interim testing just to kind of see. So in that case, they'll say, hey, all the patients who come in for the month of September, we would administer a 5-point questionnaire. How did you feel? What is feedback on whatever that you think it was? So that you can have your own internal way to gauge patient satisfaction. Because if you get that feedback from CMS, you may go like, well, I don't like the number I'm looking at. I thought we were doing a good job. But at least you now have another frame of reference to kind of compare.
Okay, so I'm not sure what your name was, but at this time it's the breakout session to kind of discuss PFAC, what your experiences were. So if I could pick on you to share, and do you need the mic or will you be able to speak loud enough for people to hear?
I don't know, can you guys hear me?
Okay, great.
So, originally, I was reluctant to have this meeting. I was like, what is this meeting? How am I gonna do it? How am I gonna find these people and get them engaged and make them actually want to be part of this? So I was feeling kind of like, but I knew it was a requirement, so I pushed on and said, I need to get this done. Made my agenda. I think my CPO gave me a mock agenda and I put it in there. I picked people that I thought would engage and I tried to get a demographic going with it. I had like 12 people who were supposed to come, 11 came. And I just like talked myself into being very positive when I delivered the meeting, you know, and not let them see that I thought this wasn't really as important as it really is. And to my surprise, I felt very good about the meeting. I felt very good about the feedback that I got from, and they gave me some perspectives that I wouldn't necessarily have thought of, even if it's just wording, because we talked about why are I made my own agenda. I wanted to know why people are going to the ER and the urgent center instead of calling the office. I wanted to know how to better get that out, you know, how to better get out the whole idea about flu shots and what else? And then I wanted their feedback about, you know, do they have any things we should put on the agenda and really discuss. And I told them about the program and how this is going to help with patients to better take care of them, and just try to engage them in understanding what this whole program was that I was in, that we're in. And even just simple stuff, like they told me that, you know, when you call your office, instead of it first coming out with after hours, if this is an emergency, call 911. They, you know, came up with, if this is, you know, word it differently and go straight into the fact that you have these docs that have been on call. And so I put some wording together, or if you, for your urgent needs, and come right through with that first, instead of telling them to go to the ER. And then one of the persons in the meeting said, don't use urgent, use immediate. Because if I hear urgent, I might still think I'm not that important. I don't know, I would never think of that, but it does sound better for your immediate needs. Doctors are standing by to take your call, that's how I put it. Just call this number and, you know, you'll connect. But I did, I got a lot of really good feedback from them. And then sometimes, I'm gonna say, sometimes you know where your problems are, but you don't think they're, and you know you have to address them, but you have no push to address them. Or maybe you're not really believing that it's as big a problem as it is, but when you hear one of those people say to you, hey, this part of your delivery is weak, it pushes you to say, yeah, I knew that, but now it's something I really need to do something about.
Good, thank you for sharing. So that's a good segue into understanding what you can do from collecting the data and making those improvements. So you talked about, you know, something as simple as changing the word of something can make a big difference. And one of the things that I've seen discussed in a PFAC meeting is definitely bringing in that language you know, the prompts that the patient may call into the office, and having that language and scripting available for the patients to see, so that they can really provide their feedback on, you know, what can be done to be improved. I've also seen the outreach letters brought to the meeting, and some of the patients, they gave the feedback that, you know, my health literacy isn't that high. I don't really understand what this letter is saying to me. Maybe we can tweak it this way. So I've seen a practice change their language in the outreach letters to be a little bit more reader friendly for some of those patients that have like a lower health literacy level. Also, one thing is the actual physical design of the office. So I know that a patient stated something like the waiting room isn't as homey. It feels very cold. Something as simple as a plant or artwork on the wall may make it a little bit more comforting and inviting for patients to be comfortable in the waiting room. Or somebody stated something about what was being shown on the screen of the TV. The practice was actually able to, instead of showing like the news or talk shows that came on throughout the day, they were actually able to really promote the different programs and resources that are available to the patient's community. An example, there was a diabetes education class that the practice partnered with somebody with, and they were able to promote that. But things like that, you can really get good information from the patients as well in order to improve that delivery of care. Okay. So session recap, we talked about the PFAC framework and the requirements. We looked at criteria and skills and qualities of what a PFAC patient would be to recruit, and then also just provided some examples on how PFAC data can improve the patient experience. Okay, if you can take the post survey really quick.